Hi, Dr. Garima here. Trying to quickly solve one more ADC related question. I have to rush to get my son from the nursery and then I have to go and attend a meeting. So I thought, might as well finish this, otherwise, today will go and no video will be short. And I'm trying to keep a consistent effort in shooting one video each day. So this is one of the scenario-based questions for the ADC exam. By now, if you would have seen my videos, you know what I'm doing here, and I'll stick to straight business and go ahead, finish, solve this question and run. So, good question this is. It's a good question because it's a simple, straightforward question, and yet because it is simple, many people have made many mistakes in answering one of the sub questions and they had doubts regarding to it. So it's nice that this question came up for me to solve right now because I'll clarify how you're supposed to think and go about the answer on this, which makes sense. Because by now you know that because there are 40 unmarked questions, two of answers can make the same sense. Even sometimes even three answers make the same sense, and then you are just doubtful as to what to do. Nothing to worry about. Like I said, there are 40 unmarked questions in the exam, four papers, so basically 10 questions in each paper, average. So for those 10 questions, don't break your head if you feel two answers are right. Just mark any one of it and move ahead. But the rest of the 60 questions will have definitely one right answer. So focus on those 60 questions. The 10 questions, don't break your head. Mark any answer that you feel like because anyways it's unmarked. Yes, you don't know which one is unmarked though, but you can figure it out when you see almost same options, and then you're like, this can be right and that can be right also. So, one of such questions. A 40-year-old woman presents as a new patient at your general dental practice. One second, I'm getting a call. I'll pause. Yeah, hi. Sorry, a call was coming. Anyways, so a 40-year-old woman presents as a new patient at your general dental practice. New patient. The patient has a fractured mobile distal lingual cusp on the mandibular right first molar adjacent to an occlusal amalgam restoration. This picture is as close as I could get, which describes the situation. Of course, the exam pictures we cannot get. Dental history, the patient has not visited a dentist for the last 7 years. She has a healthy diet, good oral hygiene, no medical conditions that would complicate dental treatment. So basically, a healthy patient comes, walks in your clinic, who's had a previous experience of dentistry, already has an amalgam filling, but she's new to your clinic. And when she comes, she's like, a part of my tooth is chipped off. Fair enough. Now, amalgam restorations are very common in Australia. You will find people doing it. And so the thing with the amalgam is that once it's set, it's set. Like it's very difficult to put an extra amalgam over it to make or build something. It won't stick, unlike a composite or a GIC restoration. So, but amalgam restorations are strong once done, and if they stay the way they are, then pretty much everything is fine. Like they have a long history of durability, strength, resilience, compressive tensile, etc. But in this scenario, probably because it was a large restoration and the enamel wall would have been weak and on biting, that part fractured. But the otherwise, the restoration is fine. It's not leaking. It's not dislodged, nothing. It's only the tooth part which has fractured. The restoration has not fractured. So, the most prevalent reason given for restoration replacement is so now in this scenario, if you have to replace a restoration. What is the most prevalent reason? See, this question is basically trying to ask you that in any given restoration, now this is a very general dental question, that in general, when people have restorations, why you need to replace it again? That is what this question is asking. Most prevalent reason, most is the keyword here, which means that all the reasons that would be given are correct, but which is the most prevalent reason. So the major probability why the restoration has to be replaced. It has to be caries. You understand? It is secondary caries. That is the only reason, or not only, like that's the most probable reason or the most common reason why any restoration needs to be replaced. The second in line is fracture. The third in line is discoloration of the restoration, especially if it's in the anterior. That the restoration is fine, but it's just completely discolored. But the most common reason why you will tell any patient to replace a restoration would be a secondary caries that you will find around the restoration because of the micro leakage or stuff. So that is what this question is asking. The most prevalent reason given for a replacement of any restoration in general, that is what it's trying to ask. In this particular case, it's because it's fractured in the scenario. You understand? But the question did not say that in this particular case. It just said the most prevalent reason for a restoration replacement. So this is one of those tricky questions because it gives a scenario. So you are hooked onto that scenario and then you will not read whether the question is about basic dentistry or it is related to the scenario. And then you'll make a mistake, you know. So you have to read and there are times when the question will explain properly that it's related to this scenario or it's just a basic dental question. So this is one of those just basic dental questions. So here the answer is caries associated with the restorations and sealants. Understood? Next is the validity of clinical studies designed to measure restoration longevity impacted negatively by. What the question is asking is all the clinical studies that are done, the systematic reviews, etc., their validity, like how credible they are, why they are negatively impacted. It's because is there no sufficient resource to measure restoration longevity? Maybe individual clinicians are inconsistent in their decision whether or not to replace a restoration. Yeah, each individual have their own sense, right? I may feel a restoration is fine and I can wait and observe. Some other clinician might say that no, I don't feel it's good enough and let's go ahead and replace. Measuring devices are inaccurate. Patients do not allow those assessments. Okay, types. All of the above. For me, I would have gone for all of the above. But sometimes measuring devices are accurate, so it's not like they're not inaccurate. And there is sufficient resources like this. So many restorations, so many patients, so it's not like resources are less. So if I had to choose one answer, I would go with option B, that it's us clinicians which are inconsistent in deciding rather than the option of all of the above. But even if you choose to mark all of the above, technically it's correct according to me because all of these options are also right. But still, somehow, I feel option B is weighing more over option E. So I will go with option B in this scenario. Clinical photography is an essential skill in contemporary dental practice. Why? Improving diagnostic accuracy. Yes. Patient communication. I love clinical photography. You know, my entire practice is based on clinical photography. If you would have seen my website, I have tons of patient pictures. And whenever a patient walks in my clinic, the first thing I do is take an intraoral camera and click pictures of his entire teeth, cheek, gums, etc. and I put it on the screen. And then we start talking. So it's very easy to communicate with the patient because they can see what I can see. So I don't have to describe and make them imagine something. What it is. Pre and post op, matter finish. Of course, it improves my diagnostic accuracy. There are times when I can spot something on the camera and I don't have to like look inside or use an indirect vision that much because my camera itself does that work for me. Images of the patient's preoperative condition form an important dental legal record. Yes, they do, and it's very necessary that you take a pre-op. Yeah, sometimes the patient comes and says, "Doctor, this wasn't there after I came back from my clinic. It happened," and you will be like, "Boss, I never touched that tooth," you know. So sometimes when you have the pre-record, you can show them, look, this is the picture I had taken, and then be like, oh yeah. And there are times when, for example, there are two teeth adjacent to each other which are having a problem, and you did explain to the patient, and the patient is like, doctor, treat just one tooth, you know, for me, and the other one I'll come back later as it's not giving me a problem. And you're like, fine. But you have taken a pre-op picture and you have seen caries in both the teeth, you know, and you have explained this to the patient verbally, you have documented it, and you fix one of the tooth and the other tooth gives the problem, and the patient's like, doctor, the tooth that you fixed now is giving me a problem. I think the filling has fallen off. And then you're like, okay, come back to the clinic. The patient comes, you check, and you find that the tooth which you treated is absolutely like perfect, and it's the other tooth which is giving a problem. But the patient will point on the tooth where you have treated. So then again, you take a picture and you show, look, I had described to you before, This is the existing tooth from the previous treatment as well. This is the tooth which is giving you a problem. Since the patient can see, they cannot go back on their words because sometimes they try to blame it on the doctor. You know, you treated it, it's not well, so what have you done? Or now you treat it for a discounted charge. You give them the truth. So clinical photography is definitely an essential skill. I will go with the option E, A, B, and C. Type of failures that are expected at long term in a restoration. Sensitivity severe enough to require immediate removal of restoration, loss of restoration, cracked tooth, margin discoloration, material chipping, secondary caries, bulk fractures, excessive wear, periodontal complications, do all of the above. Type of failures expected in a long term, I will not go with sensitivity. Class 1 restorations will rarely cause any sensitivity. Option B, in the descending order, if I have to go, that is the thing which will happen the most, followed by the least thing that is likely to happen. Then again, like I mentioned, secondary caries is most prevalent, followed by fracture of the restoration, not the other way around. So I'll go with option C in this scenario. Distolingual cusp of the mandibular right first permanent molar has fractured and is retained only by a weak attachment to the periodontal ligament. What is your management? This question a lot of candidates had marked wrong. I'll tell you why. So, what is your management? See, because it's an amalgam and we have done amalgam in our third and fourth year, but in our internship, we have not done amalgam. We work with composites and we do GIC restorations. And whenever we have found an amalgam restoration fractured or the tooth around it fractured, we either completely remove the amalgam or we place a crown over it, which is not wrong at all. Okay. But in the ADC exam, you're supposed to go with the option first, which is minimum. It's not like in our Asian countries where dentistry is way cheaper than what it is in Australia. And for everything, a consent has to be needed. For everything, a reason has to be justified. And doing a crown or replacing an amalgam restoration requires a lot of additional adjunctive efforts according to the AFRA guidelines, which we normally in Asia don't follow. Okay. So don't think with your Asian brain, think with the Australian brain. Because you're giving the Australian exam and you're supposed to practice there. So there, you have to go with minimum, like minimally invasive stuff before you jump onto something aggressive stuff. So repair the filling if there is no secondary caries. Yeah. Replace amalgam filling by composite. You have to take the patient consent for it, first of all. That should I remove the amalgam filling? But here, because the rest of the amalgam filling is not having any problem, and you can repair this filling with, say, a GIC or a composite. I doubt an extra amalgam can be dumped on the existing amalgam. So you have to repair this filling first. That is your answer. I know you may just say there is no wall of the tooth, and why don't you just give a crown covered or replace with a new amalgam filling? Replacing with a new amalgam filling is again meaning you are removing the entire amalgam filling. So you replace with composite or amalgam, it really doesn't make any difference. But giving a crown is a very better option, but crown is expensive and you cannot just go on to something aggressive like a crown. But if there is no secondary caries and the amalgam restoration is intact, you can repair this filling by just filing this area and putting a glass ionomer cement or a composite restoration, and that would stay for some while. Definitely not a long-term solution, but that's the most minimum expensive and minimally invasive as well. So immediately if you have to do something, you'll do that and later on tell the patient that is not a long-term solution, and then they can choose to go with a crown if they want, because crowns are expensive, maybe not covered in the insurance, you don't know what it is, but you cannot just directly tell the patient that crown is the only option. And anyways, in that same visit you cannot do the crown. You'll have to drill, you have to take measurement, you have to book the patient to put the crown again, and the patient has to agree for it. But if the patient says no, fix this for some short-term basis, then repair the filling if there is no secondary caries is your answer. So many of you have marked crowns, which according to me is not wrong, but you cannot just do that reading on the paper. You have to actually see the clinical scenario. I'm a patient, I come to your clinic the first time and I'm like, do something about it. So you'll be like, okay, I'll repair it for the meantime, but you have to go with the crown. You will not directly take the drill and start trimming my tooth for the crown without telling me, or tell me upfront, what it's going to cost you, like so and so many thousands of dollars, and that is the only option available. You cannot do that. Understand the clinical scenario. On theory paper, crown looks better, but in clinical scenario, it doesn't. And you are giving a clinical based scenario exam. That is how you think. Majority of the students don't think like that. They think it like on a pen and paper. It's not an MCQ exam. It's not an academic exam. Understand? Think like a clinician, and then you will clear this exam. So I hope this is clear, and I think it's time. I have to go, and looking forward to your comments. And thank you so much, Winnie. You're from Pakistan. You sent me a very lovely message yesterday. I'll read out her message. It means a lot to me. I will just read it out what she wrote. Actually, she messaged me on my Indian number, and my husband saw that message and probably wrote to her that she uses the Dubai number. And then she messaged me here. So it's like, hi doc, hope you're doing well. I'm planning to give ADC and I watched your videos on YouTube. They were very informative. You're doing a good work. I have watched many mentors, but it felt like you're working for the benefit of us and not for business. And I have never come through this feeling with anyone. I normally don't write messages to anyone, but it felt like I should appreciate you because you deserve it. Thank you. May God bless you and may you become more successful in life. Thank you so much for that. It really means a lot to me. See, I feel when I achieve success, I get more power and time to give back to you all, you know. So my success is your success. Uh, Best wishes for you. Remember me in your prayers. And last, I would like to mention that I'm from Pakistan. Uh, Country doesn't matter to me, my dear. The feelings matter. We are all human beings. It's just we have given names to the place that we stay. But we belong to this earth and finally the solar system. And I mean, staying in Dubai, I treat patients from all nationalities. So for me, a patient is a patient, a human being is a human being. I know when I was in India, the mind gets constricted because you're just surrounded by your own country people, and rarely there is interaction with people of other nationalities. When I first came to Dubai, it was very new for me because I was meeting people from various different nationalities. But then one thing I found that culturally all are similar. Everybody wants to be having a very peaceful, normal life. Nobody wants wars. Nobody wants any, fight or struggles, unnecessary struggles. The normal life struggles I understand. Everybody just wants to mind their own business and raise their own kids and do things which are legal and lawfully and just have a simple, quiet, quaint family life. So it was a very enriching experience knowing about many people's culture, how they live, and I learned so many things from other people's culture. And yeah, I know India and Pakistan are always at war because of the borders, etc. But there are so many of my friends who are Pakistanis, and we are just the same. It's just that the borders been divided. Like we think same, and the food, wow, the food really binds. I love the food. So many of my patients are Pakistanis, and it's nice to get love from you all. And of course, I send them back the same. See, when I'm shooting a video, I'm just talking to the laptop. But when you are listening to it, it's like I'm talking to you. I really don't know your face. I really don't know where you are sitting at the moment. But I do know that whatever information I'm sharing right now may be of use to you. And that's my way of helping. And like you rightly mentioned, uh, that yes, it's not a business for me when I shoot these videos. I really want to share good knowledge because I was a student at one time, and I had some good teachers who guided me well, and then there were times where nobody was guiding me well. And I just wished there was a medium where I could just reach and somebody guided me well because I really want to know and do things that I want to, but I am just not aware of that knowledge. So when I'm in a position right now where I can do that, then it's like if you want to see the change in the world, you be the change. So this is my very small attempt in making the change that I want the world to be a better place, basically. So someday when you are satisfied, happy, content, and peaceful in your life, please give back to the society. Do something which you're good at and guide somebody else so that that person also reaches your stage. So again, very grateful, and I'm very thankful that it's all your comments that keep me going on. Otherwise, like I said, it's just me talking to the laptop. I just shoot a video, upload, and I just go back doing my work. I really don't know how it's changing your life, how you're liking it. So when you leave such comments to me, it makes me feel happy that I'm on the right track. It's you also guiding me. You understand? So yeah. Anyways, bye bye. Have a nice day.